So last week we got talking about connective tissue. We started talking about the different types of fibers. We also have some different types of connective tissue. We have our loose and our dense. Loose is our areolar. Adipose is adipose fat. And our reticular. And then in our dense, we have a couple of different just configurations. Regular, irregular, and elastic. So those are our 6 different types of connective tissue that we're going to talk about today. Oof. Did you guys get to play with puppies today?
No.
You got to play with kitties today?
Not yet.
Oh, boo.
Yeah.
Oh, that's right, because they came on, the animals come in, I think, at 9. So, how exciting. Very exciting. All right, so we're just going to go through handshake, how do you do these different types of tissue. Areolar is the most common type. That would be a great test question. Which of the following is the most common type of connective tissue? Now, our areolar, remember, is like our hammock. We talked about this with the fibers. We have these little thin areolar fibers that kind of interweave, and they help to support suspended organs and glands. Now, these are going to have very open spaces. They kind of look like a sea sponge. And so what that means is these open spaces have the ability to fill up with fluid. Now, that's not normal. We don't normally want them to fill up with fluid. When they do, however, that is a condition that we call edema. Edema is when you have fluid leaking out into the tissues, causing swelling. Now, obviously, you have other things that can cause swelling, not just fluid accumulation. But edema is where you have this fluid accumulating within the tissue. I'm going to move you guys over here. There we go. And I think last week we kind of discussed what does that edema look like when you're walking through the grocery. You take your thumb and you push it into the meat. I don't know why, but every one of us has done that at some point. And your thumbprint stays in the meat. That's a perfect example of edema. And that's actually what you're going to see in your patient. We typically see edema because gravity works in the lower extremities. You can take your hand and squeeze it around the leg, and when you let go, your fingerprints will stay in the tissue. So depending on how much fluid is in there. So that's our areolar tissue. Next, we have this gosh darn adipose. Adipose tissue is your fat tissue. And these cells, unfortunately, as a lot of us found out over this year, can expand. These cells can get bigger. This is essentially your storage unit. When you take in more energy than what your body needs, a lot of it goes to the storage unit. And that's going to be this adipose tissue. We have a couple of different types. White adipose, that's the type we all have. We have white adipose. You also, though, have brown adipose. And newborns and animals that hibernate are going to have this brown adipose. And what's the difference between the two? Well, they're both fat. Brown adipose, though, is like super, super high concentration. So the person or the animal has to break down much more or less of it to get the same energy. If you think if you're a bear and you have bulked yourself up, you've got all this adipose tissue, and now you're going to go and you're going to hibernate for 6 months. You're not taking in any new energy during that time, are you? Of course not. You still need the energy for your most basic life structures, like your heart, your lungs, etc. But what I don't want to have happen is to have to break down excessive amounts of that fat. And so I have that brown adipose tissue where I can just break down small amounts of it and get the same amount of energy. So think of it like it's super, super high concentration. That's the big difference between our white and our brown. Us, on the other hand, we just have white. When you transition from a newborn into a toddler, into a child, into an adult, the fat transitions with you. Unfortunately, relatively difficult to shrink down those cells. Boo. So those are different types of adipose tissue. Here we have our dense, regular connective tissue. This is what is making up our tendons and our ligaments, which is connective tissue that connects muscles to bones and bones to bones. This looks like very similar to like a bunch of elastic bands. They're all moving in one direction, and it helps to really decrease that stretch. It helps to increase the strength. We have tremendous what's called tensile strength, meaning that it will resist pulling. If I only have one rubber band, it's very easy to pull. But if I get 100 rubber bands, suddenly now I have increased that strength. So that's what we're talking about. And when we say it's regular, it means that they're all going in the same direction. Excuse me. So tendons and ligaments. Whew. Is that hot in here or is it just me?
It's hot.
I just got like this, this flush. Just got flushed. Dense, irregular. We're still going to have these super strong fibers, but now we're moving in different directions. These are going to be like your dermis, which is underneath your skin. Your joint capsules is another example. Where we have these fibers. We're still resisting stretch, but instead of all going in one direction, now we're going in different directions. It's creating more of a sheet. More of a sheet-like structure. So regular, dense, one direction, irregular, dense, many directions. And then our elastic, this is going to be found in things like your vocal cords. I think we talked yesterday about how your vocal cords work. Extremely flexible. We also see it in areas like your bladder, your stomach. That's exactly what it sounds like. Elastic, lots and lots of stretch. We don't have that resistance to the stretch that we have with our dense, irregular, and regular. Our elastic is very, very flexible. Areas that we have lots and lots of stretch. Cartilage is another type of connective tissue. Who can tell me what the medical term for cartilage is? Yeah, chondro, with the R, chondro. This cartilage does not contain nerves. If you hurt this cartilage, it's going to send a pain sensory to surrounding tissue. It's not the cartilage itself that's going to hurt. We've got some different types of cartilage. Hyaline cartilage. Hyaline means clear or glassy. This hyaline cartilage is something that we would see in the periosteum of your bone, which is the membrane that surrounds your bone. If you're eating KFC, you ever eaten a chicken leg and you eat all the meat off of it, you see that kind of shiny covering on the bone? That's what we're looking at, is that cartilage. You have elastic cartilage, which is going to have bend and stretch. And you have fibrocartilage, which is fibrous, meaning it does not have bend or stretch. So those are our three different types of cartilage, and we'll discuss each of these just very briefly. We have cartilage primarily if our skeletal system on the epiphysis. So you guys have finished your skeletal system at this point. The epiphysis are the ends of the bones. And what that cartilage does is it helps to prevent the bone from rubbing directly on another bone. Gives it kind of a nice glassy surface to roll over. So the hyaline is the most common type. Again, that would be a great test question. A little star beside that. You're going to see that at the ends of our long bones, at the epiphysis, at the joints where they articulate. When two or more bones come together to form a joint, we say that it is an articulation. We have our elastic cartilage. which is going to withstand repeated bending. The pinna of your ear is so this is my pinna. Same thing like with the flaps of the animal's ears. And you can take that and you can bend it all day long. All day long. And it's always going to bounce right back. Well, that's an example of our elastic cartilage. It maintains its form, but we do have this ability to just kind of bend it and bounce right back. I'll give you guys a minute. What are you doing right now in medical terminology?
Cardio.
Oh, the cardiovascular system? Are you learning the pathway of blood through the heart?
We just did the periosteum.
The
The pericardium. Yeah, I know. I realized that I was saying it.
You got it. You got it. Yeah, I love the heart. Heart's probably one of my favorite systems. Ooh, I think I have a meeting this week with the Texas Heart Institute. Either this week or next week. I should probably find out, shouldn't I?
Yeah.
Yeah, probably take a look at that. It's my presence, I'm pretty big deal over there. No, kidding. I'm totally kidding. All right, finally we have our fibrocartilage. Very, very dense. This is the cartilage that you're going to find primarily between your vertebrae. It's mainly used as a shock absorber and to prevent the bones from rubbing directly on the other bones. Now, this is not the disc. Right? The disc is a fluid-filled pillow that also acts as a shock absorber. This cartilage, so if we're looking at this picture right here, this is the disc. Where we would see the cartilage is lining the edges of these two bones. And then bone itself is a connective tissue. We don't often think of bones as a tissue because whenever we see them, they look kind of like this equine leg over here. They're very white. They're kind of, well, that's dead bone. It's a tissue that's dead. Bones are very dynamic. They do have blood supply, arterial and venous. They do have nerve supply. They have a lot of different openings in them so that we can get nutrients in. Bones also make blood cells, and we need to get those out. Bones create nutrients that we need to also get out. We have the intramedullary cavity, which is the space in the middle of our bones. Very well vascularized. Is anyone in here, I don't know if I asked you guys this last week, anyone in here ever broken a bone? I got a few people. What'd you break?
My nose and my thumb.
Oh, God.
2 different instances.
I was about to say, holy smokes. What did you break?
My pinky.
Your pinky? Oh, what'd you break?
All the food.
Oh my God.
Shut up.
I landed wrong in a beat. I broke my ankle on Saturday, but I did not.
Oh my gosh.
Yeah, apparently 31 years old is too old for the trampoline parks now.
Oh, boo. It's always a shame when you find that out, isn't it?
Yeah, it took 4 jumps.
Oh gosh. Yeah, I know
I have a
better.
question.
Yes.
What does it mean by loose and dense tissue?
What does it mean by what?
By loose and dense tissue.
So loose and dense tissue, loose tissue is going to be just that, where the fibers are very loosely gathered together. And dense is going to be where you have a lot more numerous fibers that will withstand stretching and elasticity. So when you have your loose dense, that's going to be where the fibers are not as packed together, but it is still going to withstand the stretch. So that's kind of what we're talking about. It's mainly just the configuration of the fibers that gives it the name.
Okay, thank you.
So our bones, bone, medical term for bone, osteo. We have all of these little channels. I mean, again, when we look at a bone, it looks just like a kind of a. Go ahead and get everybody muted. All right, so when we look at a bone, it really does look kind of like this dead hard structure. But we do have a ton of different openings. One of these openings is called a haversian canal. Canal simply means opening. And this haversian canal, well, we've got to be able to get our blood supply into the bone without decreasing the strength of the bone. And so we have these tiny little holes that go into the bone, and that allows our blood supply to enter. So when you broke your bone, when you broke your pinky, or you thought you broke your ankle, when you broke all the toes on your foot, oh my goodness gracious, I can't even imagine. What happened to the area around it? Swollen? Did you get a bruise? Mm-hmm. Holy smokes, heck yeah. Because when you break a bone, it's gonna bleed.
Oh, that's why if you break your femur, you can bleed out.
Yes. Femur is the largest bone in your body, and if you break it, you can in fact bleed out. I know. I mean, if you think about the bone and you just crack it, well, you've now ripped all of those blood vessels. So I'm willing to bet, especially with all your toes, you probably had a bruise halfway up your leg. Yeah, I broke my ankle. I did a shear fracture on my ankle, which was awful. It was awful. And I had a bruise from my toe. So what happened, what a shear fracture is, so I had this inside knob, which is called the medial malleolus. And I was lifting up a tile sample, and it was very heavy. And I dropped it. And it came down just like that. And it sheared right and just knocked off the knob. Yeah, it was terrible. And I had a bruise from my toe almost up to my knee. Yeah, it was awful. I also fractured my skull. That was not my best day. Yeah, I fractured my skull from here at the crown, and I fractured out all the way down to my temple. So that's my lobotomy scar right there.
How do they fix that? How would they fix something like that? Isn't it really hard to do? Or
yeah, I got lucky. I say I got lucky. So what happened was I was doing, you ever stand in the shallow end of a swimming pool and you just jump backwards like a dolphin?
Oh my God.
And you just jump, do everyone know what I'm talking about? Where you just jump backwards like a dolphin and do a backwards somersault. Well, I was at my aunt's pool. I was about 17, so I wasn't a child. And I was seeing how many of these somersaults I could do. So I just kept jumping back, but I didn't realize I was moving closer and closer to the edge of the pool. She had a tile lip around her pool, and it was just fortuitous that the one tile so I jumped back all fours, hit, and the tile I hit had been cracked. So it hit me here, and it fractured me all the way down, opened my scalp. And there was just like jaws. I don't remember any of this because I don't know. I don't know. Just this, my aunt was sitting on the chaise watching me, and just this like jaws cloud of blood. And she said, I came up holding my head and I looked down and I started screaming. And she jumped in to get me, called the ambulance. What they ended up doing is, so I did go in for x-rays. At the hospital, they just flapped my face off.
Oh my God.
So, because my scalp was open from here to here. So they just took it and flapped it open so that they could feel for a fracture. I did have a fracture, so they sent me for radiographs and MRI to see if I had any brain damage. Yeah. Yeah, that part I remember very vividly. Because they were like, okay, you're gonna feel a little pressure. Well, they numbed it up. But they're like, you're gonna feel a little bit of pressure. And I was like, okay. And they're like, you may want to close your eyes. And I was like, okay. And I didn't close my eyes. And I probably should have closed my eyes because suddenly I'm looking at my own forehead.
Oh my God.
And I'm like, oh my goodness gracious. So I got very lucky because it was a hairline fracture that was not displaced, meaning that the bones were still, they were on the same level. It didn't like do a little, one was higher than the other. If that had happened, they would have had to go in and do plates. Would have had to put plates in my skull. Because mine were still what we call in good apposition. We just left it and it healed on its own. But think about the bruise. You know, imagine that's in your skull. My eyes were so blackened and swollen, I couldn't open them. So from my top lip all the way up past my hairline was just this purple bruise, this magenta dark purple bruise. That was awful.
Do you wear a mask?
Now I got a cool story to tell. How I fractured.
And so were your eyes, like all the blood vessels busted? Your eyes were all bright bloodshot red?
Oh yeah, the white of my eyes was totally red.
Yeah, I bet.
Totally red. The whites of my eyes, and then everything from my upper lip up was just, I can't even describe to you how bad and how dark this bruise was. It was a black purple bruise.
God.
Oh my gosh.
How long did it
Probably took about 6 weeks before I looked half normal again.
And that's by the time you were starting to go like green and yellow, right?
Oh yeah, that was a fun time. The green and yellow phase was a really attractive phase on me, I'm telling you.
I would want a mask.
Well, I mean, it's still the majority of the bruise was up here, Eric. What am I gonna do?
No, I would have done like a full one.
So luckily it was while we were on summer break from school.
Yeah,
So I didn't have to go to school.
yeah.
So you could
That
have
would
used
have
the
been
full
hell.
helmet
Oh my
from the
gosh.
motorcycle.
It was terrible, but yeah, so that's showing these canals, your bones have dramatic blood supply. Dramatic blood supply. And so our haversian canals are one of the types of canals. When we get into our skeletal system in the next chapter, we're going to talk about some of the other, like our nutrient foramina. We have our Volkmann's canals, haversian canals. And so we're going to talk about all of this dynamic little openings within your bones that help to get stuff in and out. And then, of course, you all know we have this fibrous membrane that covers all of our bones called the periosteum, around the bone. Yeah, that was not a good time. But like I said, if something bizarre or weird is going to happen, it's going to happen to me. It is.
I was gonna say that one time my little brother, I'm not sure how, but he ended up running his forehead in the fireplace, and then he like cut like a slit open, and you could see his bone. It was
Yeah.
terrifying.
Oh, yeah.
My dog did that. He ran right into the bottom of a ball hitch. I don't know what he was doing, but he ran right into the bottom of that ball hitch and sliced his whole forehead open.
Oh, my
And
gosh.
like had to rush into the vet. You could see his skull and everything.
Yeah.
He was-
It's amazing, though, that there's just not a whole lot of
Nothing.
tissue covering it. It's so thin.
Mhm.
Yeah.
It's so thin. And it bleeds like crazy.
Yeah, I thought he was dying. I mean, he was my baby. He was my like heart dog.
Yeah.
but-
Bleeds like there's nothing that bleeds like a scalp wound. So I was very lucky, though. My aunt came in the ambulance with me, and she insisted that no doctor was going to sew me up unless it was a plastic surgeon. And she was adamant. She obviously called my parents because I had been staying with her for the weekend. Called my parents. My dad walks in just as they're slapping me open. And he was like, oh, geez, oh, no. And so I'm very grateful to her because it had she not insisted on that, I would have had just a most terrible scar, and it's shrunk up.
Yeah,
I
it
can
looks
still
really small.
I could just imagine the phone call to like your
Oh, I
parents
know.
and just being like, I know she wasn't like this when you before you gave her to me, but like
When you dropped her off, she was okay, but okay, we got good news and we got bad news. The good news is she's alive. Bad news is we broke her just a little bit. She's a little bit broken. Blood. Yeah, there was a copious amount of that when that happened. We have 3 different types of blood cells, and that's essentially all your blood is, fluid and cells. You have the fluid portion, which is plasma, because it still has clotting proteins in it, and you've got your cells. Circulating cells, we have our erythrocytes, which are red blood cells. They carry oxygen, carbon dioxide, and nutrition around your body. Our leukocytes are the warriors, the military of your body. We introduced to the 5 white blood cells earlier. And then your thrombocytes are your platelets. I call those the Spider-Man cells because they pew, pew, pew. They do spit out like these little fibrous, they do. So when you have oxygen in your body where there's not supposed to be any, right? So when you, oh no, I cut myself. There is oxygen now going in here. There should not be oxygen going in there. And your little platelets go, oh dear, oh no. And now they're seeing this waterfall cascading out of the body and they're like, oh gosh, that's not good. And so they go, pew, 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 and they pull the edges together. And then they keep going and they form this big web so that your white blood cells have something to get stuck to so they can fight off any foreign invaders that are now trying to get in there. So it's very dramatic.
So is that the same thing, like say blood shoots out like that?
So when blood is shooting out, what that is you, every time your heart beats, right?
That's
Yeah.
pushing it out.
Do what?
So that pressure is just like.
Mhm.
pushing it
Yep.
out.
So when your heart beats, it splooshes out and has very high pressure behind it. If you open up, because arteries have a higher pressure than veins. Arteries are directly impacted from the beat of your heart. So first off, you cut yourself, and the first thing that happens is your body goes into holy crap mode. What happens to your heart? It starts beating faster and harder, which raises your blood pressure. So now if you have clipped one of those very high pressure big vessels, every time your heart beats, it's gonna spurt.
Because that's what happened to my mom. Because she has like those veins that come out of her legs, and one of them, like I guess she cut it with something, and it started shooting out blood.
Yeah,
Like,
that happened to us when we were doing a surgery once. Did I tell you about when we transected the carotid artery?
No.
Oh yeah, don't do that. Don't do that. So we had a boxer, and it was had what we call a salivary mucocele, which is just a big cyst in the salivary gland. Boxers are prone to them. Normally you don't do anything with them because it's benign. It's not cancer. There's just no point. Well, this had gotten so big that he'd start chewing on it when he was eating. So we were gonna go in, it was his sublingual right down here. And so we go in and we open here, we open, and there's this big mass. But the problem is this mass has kind of tendrilled around the carotid and the jugular. So we got to clip it away from these 2 blood vessels. Well, what we ended up having to do was we ended up having to tie off the blood vessels. He still has the other side to feed his brain. But in order to get the majority of this tumor out, we had to ligate and kind of destroy the blood supply on the one side. So we did the jugular with no problem, and we cannot find the carotid artery. The carotid artery is much deeper than the jugular. When you see that big blood vessel, that's the jugular, and the carotid is in behind it. The carotid is the artery, the jugular is the vein. This dog being a big boxer, his carotid artery should have been bigger around than my thumb and pulsing. We can't find it. So me and the dog, we're looking in this big crater of a hole in this dog's neck. And so we see this teeny tiny little fin, looks like a worm. I was like, that's not the carotid. He's like, well, what do you think it is? And I was like, I don't know. Maybe it's a nerve. Maybe it's a cranial nerve. Strum it. You strum a nerve, especially if it's facial nerve, it'll cause him to contract. So we strummed it, nothing happened. I was like, okay, well, let's see if it is a blood vessel, blanch it. Blanching's when you push and you release and you see the blood come back. So we blanched it, nothing happened. I was like, okay, it's not a blood vessel, it's not a nerve, cut it. And he went, okay. And so it was, you got to, just like, it's like a cartoon. So he cut it and we're both looking at it. And it took like 2 or 3 beats and suddenly it was like, and I'm like, when in reality, I could have just really done this. The pressure behind that, if I am the dog laying on the table right here, it was easily hitting the wall. It was easily hitting and hitting me in the face. And I'm like, it was, so we got it tied off. The dog was fine. The dog recovered just fine. But that's the pressure that you're looking at in these blood vessels. Crazy blood pressure.
Why is it so small?
Don't know.
But
It wasn't small after we cut it, I'll tell you that. That sucker opened up like, holy smokes. Niagara Falls. All right, so another connective tissue are our mucous membranes, and these are always going to open up to the environment. Like in your esophagus, in your mouth, you have mucous membranes in the conjunctiva of your eye, you have mucous membranes inside your nose, and these are going to control what goes in and out, and they also form a barrier. They also have a very high incidence of your immune system in these areas. Because they open up to the environment, you're constantly having foreign invaders trying to get in to hurt you, right? You're breathing them in, you're in your nose, in your mouth, you're taking in food, which is alien material according to our bodies. Our bodies doesn't know what it is. And so these mucous membranes are going to help to control and monitor what comes in and out and decide, do we need to launch an immune attack against it? They're very absorptive. In fact, a lot of the medications that we use, you simply absorb them through the mucous membranes. If you've ever taken like a B complex vitamin, put it under your tongue, it absorbs through the mucous membranes into the blood vessels. If you take a CBD for anxiety or pain, anything that you just smear on the gums, that just shows just how absorptive. And of course, we do our CRT using the gingival tissue. Does anyone know what a CRT is? Nice, the capillary refill time. You blanch it, you push on it, then you count how many seconds does it take to pink back up. It should take less than 2. If it takes more than 2 seconds, that's something we need to remark in the medical file.
That can be like if they're dehydrated, right?
If they're dehydrated, they'll be sticky. If they have low blood pressure, it'll affect the way that they fill. Buprenex is just one of the pain medications that we use very often in cats, where you can just smear it on their gums and it works as a very effective pain medication post-surgery. And you don't have to try and give them a pill. Pilling cats is a pain in the neck. Yeah. Killing dogs is one thing. Dogs are, you hide it in some cheese. Cats are not that stupid. And what happens with cats is you get your pet pillar, you get the pill down and it sticks right in the middle of the esophagus. And instead of dissolving in the stomach, it dissolves in the esophagus and causes an ulcer. Yeah, not good. So if we can give them medication that they don't have to swallow, that's always a benefit. That's always a big plus with our cats.
So does that happen with dogs?
Not as often with dogs. Because anytime you touch a dog's mouth, it automatically starts them salivating. Yeah, so the minute that you open their mouth, their brain goes, oh my God, we're getting a treat. And it starts them salivating. Cats, that doesn't happen. Cats don't do that. So. We have a couple of different things that are secreted from these membranes. So obviously a mucous membrane is secreting mucus, but we also have serous membranes, and serous is just a much more fluid, much more liquid. This is going to line and cover our organs. For example, remember when we were talking about the visceral and the parietal peritoneum? That's a million years ago, isn't it? We had the membrane coverings on the organ or on the cavity itself, which was parietal. We had the covering on the organs, which was visceral, and the abdomen is the peritoneum. Everybody remembering these words? Well, this is going to create fluid, and this fluid is used as a lubrication. But if I have an overcreation of this fluid and I start now having fluid accumulating in the cavity, that's known as effusion. So I have pleural effusion. If it's in the chest, pleural effusion, because pleura is the chest. If I have a large amount of fluid in the abdomen, it's called ascites. And you can actually tap it off. So if I have an animal with ascites, and there's a lot of different things that can cause ascites, heart failure to go into the cardiovascular system, like what you're doing right now. If I have right-sided heart failure, that'll cause fluid to accumulate in the abdomen. Just take a big needle and stick it into the abdomen and just suck it right off. It's this yellow and it's kind of sticky. So those are serous membranes creating fluid, typically for lubrication, but if it overcreates, that can cause either pleural effusion or ascites in the abdomen. Our cutaneous membrane, this is the membrane that's always exposed to the environment, also known as the integumentary system. What is the common term for this type of tissue? Yeah, your skin. Give me the medical term for skin. Derma or dermato. This is the stratified squamous. Remember, that's constantly being sheared away. And we constantly have new cells right behind it to take their place. And so we have our epidermis, which is this part that you can see. We have our dermis, which is the part underneath. And then you have your hypodermis, which is the layer underneath the dermis. And if I have a hypodermic needle, where is that injection going? Beneath the dermis. Beneath the dermis. And here we have our synovial membrane. Where do you think you might have a synovial membrane? In your joints. The synovial membrane lines the cavities of the joints. So when you have your freely movable joints, right, you have, remember, your diarthrosis, amphiarthrosis, synarthrosis. Did you guys learn about that in MedTerm? So your diarthrosis are the freely movable joints. And we have to have oil to keep the Tin Man moving. The synovial membranes are what are going to create that oil. They create this very slippery fluid. It's very, very thick and very, very slippery. And it helps the bones to move over each other. So we have the synovial membrane. This is where this meeting, they decided to cut us a bit of a slack. Because they're like, hey, Johnson, did you name all that stuff to go with the joint? And Johnson's like, oh, crap, that was due today. Yeah, I finished that, yeah. It's going to be called the synovial membrane. And they're like, that sounds great. What's it going to make? He's like, it's going to make synovial fluid. They're like, that sounds even better. Where does this fluid accumulate? You know, the synovial cavity. Brilliant. Get this man a raise.
I know.
I just have this vision.
Every scenarios, they just bring the lesson to life.
He's like, yeah, this is synovial. This is synovial fluid. Yeah. Fill up the synovial cavity. Sure. And it's made by the synovial membrane. What are these joints going to be called, Johnson? Synovial joints. Yeah, we're totally just going to call those the synovial joints.
I didn't Johnson the rest. Yeah.
I know. I mean, it would have been much easier, wouldn't it? If Johnson had been in charge, there would be no need for you to take a medical terminology class because it would just be like, okay, this is the weird bendy thing. This is the front leg bendy joint, and this is the back leg bendy joint. Johnson, you're brilliant. All right. Is everybody on the bus with all of our connective tissues? Because we're now moving into the third of our 4 types of tissues. Muscle. I'm assuming you guys, oh yeah, because you took a muscular test. So this is going to be super duper reviewy for you guys. Skeletal muscle is attached to our skeletons. It is voluntary, meaning that we can choose to move it. And it has these little stripes. And these little stripes are because of the proteins that we use to manipulate the muscle shape. These muscles contract, and that's the only thing they do. They contract, they get shorter, they get wider. And that's why everywhere you have a skeletal muscle, almost everywhere, you have to have another muscle that is in its opposite. So for example, in my bicep is attached down here. And so just like a puppet string, it causes this motion. But now I need another muscle to undo that motion because muscles only contract. They can contract and they can relax, and that's it. So now I've got this muscle, which is attached here, and when I contract that one, I have an opposite action. So those are our skeletal muscles. Smooth muscles don't have stripes. They are also not under your control. For example, your intestinal tract is made of smooth muscle. And the way that they contract is a little bit different. Instead of contracting towards the center, becoming shorter and wider, these ones have a circular contraction, like squeezing toothpaste out of a toothpaste tube. And they have these waves of contraction, one after another, after another, after another. And that's what pushes stuff through, like your intestines. You can't consciously control it. I can't say, okay, everybody right now, move your small intestine slightly to the left. It doesn't work that way. It doesn't work that way. And then finally, my favorite type of muscle is your cardiac muscle. It's a very specialized type of muscle that is only found in your heart. Now, the thing is about our cardiac muscle is it is involuntary. And you're like, but my yoga teacher says they can control their heart rate. No, they can't. No, they can't. They cannot. How do you speed up and slow down your heart rate? What you can, in fact, do is elicit your nervous system. So when you're like, oh, I'm going to speed up my heart rate, you can think of something that gives you anxiety. That'll cause your heart to speed up. You are not, though, consciously controlling your heart rate. This cardiac muscle, though, even though it is involuntary, it does have little stripes on it like our voluntary. It is called involuntary striated. Striated means to have stripes. The reason why our cardiac muscle has stripes is they have these little special call centers in the cells Because our heart muscle, more than any other type of muscle, every single heart cell has to contract at the exact same time, at the exact same strength, at the exact same rate. And so these cells all talk to each other in order to coordinate that. Because if they start going rogue, we get spaghetti heart. We need a nice love-dub, love-dub, love-dub. We don't want this.
Not like arrhythmia.
Yeah, arrhythmia is without rhythm. This is the rhythm. Atria, ventricle, love-dub, love-dub, love-dub. This is without rhythm, arrhythmia. And there's 1,047 things that can cause that to happen. So these cells are very smooth. They just have one nucleus, but they do have these special areas. These areas, you don't have to write this down, it's just so you've heard it before. They're called intercalated discs. And they're only found in the heart to allow these cells to talk to each other. Oh, there it is right there, intercalated disc. Finally, the fourth type of tissue we have is called nervous tissue. This is what sends messages from your brain to your body and back from your body to your brain. We have a couple of different types of messages we can send. Your brain sends motor messages to your body to create a movement. And your body sends sensory back to your brain for interpretation. What's happening in our environment. We have obviously our 5, well, technically we do have 6 senses. No, I am not crazy. We have our 5 conscious senses, right? Sight, smell, taste, touch, etc., hearing. We do all, however, have a 6th sense, and I find that fascinating. Yeah, I don't know how many of you have siblings, but have you ever played a little known game called I'm Not Touching You, Can't Get Mad? It's awful. Yeah, I'm not touching you, can't get mad. I'm not touching you, can't get mad. It's awful. It's absolutely awful. Here's another example of your 6th sense. And this 6th sense, now, am I saying you're all psychic? Of course not. I'll be like, Mr. Hamilton, this stuff has gone completely crap crazy. No, it is left over from evolution. It is a danger sense. You ever been sitting in your car and your jam comes on the radio? And you're just belting it out, you're doing your car dance. Oh Lord, every one of us has done it. And so you're just jamming out, and suddenly there's nothing in your environment that's changed. You just stop and you look over, and the car is like looking at you like.
I always feel the look at me.
Yeah. Before COVID, I used to do this fun experiment when I get 4 or 5 of you up here, facing out, and I would just come up silently, because I'm a ninja like that, and I would just stand behind one of you. I'm not touching you, I'm not breathing on you, nothing. I'm just standing close behind you. 100% of the time, that person does this little shiver and then takes a step. So that's our 6th sense. It has to do with there actually is an anatomical physiological reasoning behind it. We have this cloud of electrons around us at all times. We learned about that at the beginning. The more electrons you have, the more negatively charged you are. If I disturb that cloud of electrons, it is something palpable that you are able to unconsciously be aware of. I find that kind of fascinating. The neurons are the longest cell of the body, and they have some different parts. In fact, the neuron itself looks very similar to your forearm. We have our cell body, which is right here at the palm of my hand, and that's where the nucleus is. I have dendrites, which receive messages from other neurons. These messages come in. They are assessed here at the neuron. They move down the body of the cell, called the axon body. They exit the terminal button to another neuron. And that's what forms a pathway. And there's a very specific pathway for everything. That's why when my brain sends a message, neuron to neuron to neuron to neuron, shake your leg, it's the pathway specific. That's why when my brain says shake your leg, I don't do this. Because that would be a very different pathway. Neurons are the rock star cells of the body. They are the movie star, they are the Brad Pitt, they are the Johnny Depp, what have you. Every rock star, every movie star needs an entourage. A bunch of people to support them. The bigger the star, the bigger the entourage. Bam. Same thing here. The bigger the nerve, the more support they need. And the entourage people in this case are known as neuroglial cells. That's just the name of the entourage. Neuroglial cells. Now these cells do not transmit impulses. They're not neurons. They don't know how to act. They don't know how to sing. They're only there to support our superstar. The neuroglial cells are only there to support the rock star, the body, the neuron. And of course, they're going to be found in more number than the nerve. For every nerve, you have multiple support cells. You don't have a giant star like Johnny Depp walking around with one person in their entourage. Well, honestly, one person is not an entourage, is it? It's just a guy that won't go away. It's just like, he's just there. Yeah, it's like a stalker. You got to have more people in the entourage than the rock star itself. So these neuroglial cells do not transmit impulses. They don't know how to do that. They're only there to support our movie star. Finally, all of this comes to, we've now been talking about its normal configurations. But what happens if I damage? What happens if I damage any of these tissues, epithelium, connective, muscular, or nervous? I need to repair, and that's the amazing, amazing, magical thing about our bodies, is they can heal and repair these tissues. I find that absolutely astonishing. The first thing that happens when you injure yourself is inflammatory reaction. What inflammation is where your blood vessels to that area, okay, so bam, ow, oh, I hurt my elbow. All of the blood vessels going to this area are gonna widen. Why would that be? Because I've got to rush the military and I've got to rush the oxygen and the nutrients, because think about what happens to the energy needs of these cells that are now having to repair. It goes up. And I got to provide that. So all of my blood vessels expand, diverting more blood. What does that do to the tissue color? Makes it red, because greater, I may not have damaged my blood vessels, but if you have an area of inflammation, it's red. Because guess what color blood is? Red. And if I have more blood being diverted to an area, it's going to cause the tissues to go red. If I have more blood being diverted, it's also going to get swollen. That tissue is going to swell. And it's going to become painful. And that's really your body getting a message from your brain, don't use it while we're getting it fixed. And if I hurt my elbow and then I just continuously just use it over and over and over, is it going to heal? No. So I divert the blood, it gets red, it gets hot, because more blood means more heat. It gets swollen, and your brain sends a message, pain. So now I don't want to use it. And it's going to allow my body time to fix it.
So like when you're like your foot or ankle or whatever in the mom test, it just walk it off.
No! So here's the deal.
Now, my boyfriend lost his mind when I said, "Can I just walk it off?" He's like, "Are you?"
He lost what?
He's like, "What do you normally do when you roll your ankle?" I was like, "I'm gonna just walk it off." He's like,
No. Okay, so here's the deal. Here's the dealio. Pain, I know I'm saying something and you're gonna be like, no, duh. Pain is not normal.
What?
I know. Pain is, remember I said, like, we have our body, and then a separate entity, we have our brain. Pain is your brain's way of telling your body, stop. Something's wrong. I need to assess. I need you to stop using that thing. Like if you have your car is not working, if your car is sick, making a bizarre sound, you're not gonna be driving past the mechanic shop and have him running beside the car trying to diagnose what is wrong with it. What do you need to do? Stop. Let him assess. Let him repair.
Is it the same thing with working out?
Oh my gosh. Oh my gosh. All right, so here, I was just getting to that. So pain is never normal. Pain is literally your brain telling you, stop. Stop. Just stop. I have stuff I gotta fix. I need you to pull it into the shop. I need you to shut it off. When you are working out, and you're like, feel the burn, feel the burn. What happens to the oxygenation needs? They increase, right? Everyone gets paid. What happens to your paycheck if you're being asked to work harder and harder and harder? It goes up. I have these little 18-wheeler cells that all they do is transport. They're called erythrocytes. They fill up the back of the truck with oxygen and they rush it to the areas. They pick up, turn and burn shipment of carbon dioxide, get rid of it. You're now producing more carbon dioxide. You're now needing more oxygen. The problem is that the tanker trucks we use, that we have in circulation, that's all I got. So if my needs go higher than what my tanker trucks are able to deliver, now I'm in big trouble because my body's using more energy than I'm able to provide it. That equals death. I've got this big organ on the left side of my body called the spleen. And the spleen's job is a big blood sponge. He's the one that houses juvenile red blood cells, kind of takes them to boot camp, trains them how to be a red blood cell. He's also the senior retirement community for old blood cells that are too old to do their job, but not too old to not have any purpose. Think of like Walmart greeters. And that's your spleen. They still have a purpose. So your brain is going, all right, I told this idiot, stop. Okay, we can't keep up with this demand. The deliveries are not enough. They won't stop. So we're here in panic mode where I think we're gonna die. I think we're about to die. Spleen, I'm gonna need you, buddy. It's a one and done, I get that, but I need you. And spleen goes, on it, boss. And spleen does this massive contraction and splooshes all of these juvenile and senior cells into circulation. Because even though they're not up to 100%, they're better than nothing. And so I cannot increase the carrying capacity of my cells. Once a truck is full, it's full. I can, however, increase the number of trucks on the highway. The problem is it's a one and done. It's going to take 24 hours or so for the spleen to replenish. So when the spleen does this massive contraction, it gives you a super sharp, incredibly painful
That's what that is. Okay.
stitch in your side. It'll take your breath away. Brain is now literally screaming at you. If you keep this up, you're going to die. So I'm going to shoot you full of pain to stop. Just stop. Please, I'm begging you, stop. Because if you keep going the way you're going, I don't have anyone else to put on the highway. So we're gonna die. And you get the stitch, and it's always in your left side. Because he's saying stop. So when your coach tells you what, walk it off, push through the pain.
Yep.
That's the worst thing you can do, because then eventually your brain is just gonna go, oh, this guy's an idiot. What kind of idiot have I been saddled with? You know what? He's not listening. We did the pain. That didn't work. Spleen, good job, buddy. I'm real happy about that. We don't have enough trucks. He's still going. Just, what an idiot. He's a moron. He's still going. How is he still going? All right, boys, shut it down.
That's like muscle failure.
Shut it all down. Shut it down. And you can see funny, okay, they're kind of funny, videos of marathon runners at the end of the marathon where they've gone so far past their body's capacity that they collapse, or their legs are literally, their limbs are like this. Because their brain went, you know what, if you're not going to listen to me and you're not going to listen to spleen, we're just shutting it all down. I'm not dying because of you, idiot. Shut it down. And he does, and he shuts it down, and that's when you go down.
My coach, one time we were doing like squats with weights. We had to max out on our weights. And I told her I feel like I was going to get a cramp. And she was like, no, you have to keep going, keep going. And then I was going down and I literally fell with the weight on top of me.
Yeah, your body will just go, hey, shut it down. So that's what that is. I know I got a little off topic, but that's what that is. So that's our inflammation. We have pain to prevent further damage and allow our bodies to heal. Now, the thing I need you to know, inflammation is not the same as infection. Can you, moving my mask down, I get excited and then I talk really big. Can you have inflammation with infection? Do you have to have infection to have inflammation? Does everybody see that? So we've now damaged some tissue. We need our epithelial cells to repair it. This is called granulation tissue. We have these granulocytes. They're these cells that have little grains of sand, it looks like. And these are the cells that are going to fill in the area initially. So when you cut yourself, your platelets pull together, form a web, blood cells are stuck in it. Now your epithelial cells are coming in from the bottom. The first type of tissue that is initial healing is granulation tissue. Now for you equine people, I don't know how many equine. So what happens, you have a horse, it can happen in dogs too. You have a horse and let's say they get a cut over a joint, like a knee. Well, you can't really tell your horse, don't use that leg anymore, because that's not the way that they're constructed. So you got, so again, I'm visual. So we have the horse standing, we have granulation tissue beginning, right? Which is the kind of the dense beginning part of healing. So I've got all my cables, this very dense cells are rising up, and the horse moves, the whole thing tears apart. And your body goes, come on! I just got that. Lay it thicker, pull it apart. Come on! Lay it down thicker, pull it apart. So now your body's like, that's it. I'm gonna lay this sucker down like gangbusters. And you get what's called proud flesh, which is where your body overproduces this initial scar tissue. And you're actually gonna have to go in and cut it off. Because what happens is this scar tissue, because now my body's trying to heal this and I keep bending it. So what's my body gonna do? Prevent me from bending it. So what it does is it takes that scar tissue and it tightens it up. And it tightens it up. Like this is now my scar tissue. So tight that guess what I can't do anymore? I can't bend that. Your body's like, told you don't bend it, and you went and bent it, and now I'm gonna make sure you can't bend it. Haha. Well, that's not good because that's not how horses move. That's granulation tissue.
So if you cut it off, wouldn't that be a problem?
Was what?
If you cut off like the.
Yeah, once you get a horse with proud flesh, you're just trying at that point to get them mobile. Because the big problem with horses, you know enough to be dangerous. Horses' digestive system is very, very sensitive. Horses and their GI tract don't get along on the best of days. A horse is dependent upon movement in order for their GI tract to work normally. That's why you can't just suspend them, like, because you're like, well, why just put them up in this box and just take their feet off the floor and just let them hang there for a while. They have to have movement, and it's that pendulous motion when they're moving that helps their gut to move the food through. If you have a horse that is not mobile, you got a horse that's going colic, and then you got a dead horse. That's a dead horse.
What happens when
Immobile colic horse is a dead horse, because how do you get rid of colic?
you have to get them up and
You have to get them walking, get everything mobile.
There's the hardest thing in the world to pull a horse up when they're down. Like, look, the hardest thing.
Yeah. Oh my gosh, I can't even imagine. We have a couple of different classifications of tissue healing. First, second, and third intention. First intention is where you cut yourself. I put in some stitches. I put in some staples. I put on a butterfly bandage. I have something artificial holding the wound together. That's first intention. Second intention is where I just leave it to fill in by itself. Right, like you pick a scab, starts to bleed. Am I really gonna put a stitch in that? No. Apply a little bit of pressure. Just let it go. Your body's gonna fill it in on its own with that granulation tissue. The granulation will turn into epithelial tissue, create a scar. I got a really great one right here. See if I pull it. See that divot right there in my arm, the smile in my elbow? Yeah, that's scar tissue. That's where granulation tissue has turned into epithelial tissue, but it's less flexible than the tissue around it. So just let it heal is second intention. Third intention is a combination of both. Third intention is where I leave the wound open because there may be some contamination. Think about a dog that's been HBC. Anybody?
Where you put the drainage to.
No, this is more of trauma injury, hit by car. You should have said it, hit by car. And the dog goes dragging along the road and now it has all dirt and asphalt and grass and stuff. So we got dirt and grass and contaminants. So do I really want to close all of that crap into the cut? No, of course not. So third intention is a combination. I first leave it open so I can decontaminate, I can irrigate over the couple of days. Then I go back in and I close it with sutures or I close it with staples.
Would that be like when you put a drain in? Like when you, would that be the same thing?
Yeah, so a drain tube is kind of the same thing. Your body does not like to have a void. And so if you have a void, it fills up with fluid. The problem is that if it fills up with fluid, your body can't heal the tissue. So you put a drain tube in to keep the fluid from accumulating. So first intention, artificial closure. Second intention, just let it go. Third intention, combo of the two. And that is our tissues lecture. So tomorrow, we're gonna get started on the skeletal system. I do have some time worked in to do a wee bit of review, and I think we're gonna do the tissues test on Wednesday. And it'll be a 3 o'clock test like we did the last one. So we'll do that tissues test. That'll give us time to do review tomorrow. And we'll do that on Wednesday. And then if you
I have a
guys will,
question.
yes.
So for the test, should we use the condensed PowerPoint or the testable one?